Hello, and thank you for joining us. Welcome to What to Expect Initial Special Education Evaluations. Evaluation starts with consent. The school district evaluators explain the scope of the evaluation and what areas will be assessed. This is called the notice. If there are outside evaluations, these are reviewed and considered when developing an assessment plan. Consent is a parent signature agreeing that the school district will do an evaluation for special education. Informed written consent means you understand the evaluation, you give permission for the evaluation, you have been given a copy of the procedural safeguards, you have been informed in a language you are familiar with and understand, you understand that you can withdraw your consent at any time. Once written parent consent is obtained, assessment can begin. The school district has 45 school days to complete the evaluation. A written report of a full individual initial evaluation of a student for purposes of special education services shall be completed no later than the 45th school day following the date on which the school district receives written consent for the evaluation. Next, we'll talk about what happens during the evaluation window. Parent input is vital to the evaluation process. You may receive paperwork to complete that could include information about your child. Some of this paperwork could look like developmental history, strengths, concerns, academic performance, language information, and family structures, and could be in any of the following formats: forms, rating scales, email from the evaluator, parent questionnaire, and interview. Each evaluation team is individualized based on your child's needs and the scope of the evaluation, but you may interact with these following professionals: educational diagnostician. Educational diagnosticians implement the special education appraisal process. They assess the educational, learning styles, and program needs of students referred to special education services. Licensed specialist in school psychology. Licensed specialists in school psychology assess the psychological and psychoeducational needs of learners referred to special education, including psychological evaluation and report writing, behavior management, and counseling. Dyslexia therapist. Dyslexia therapist evaluates for the presence of dyslexia as part of a multidisciplinary team looking at the impact of reading and writing. Speech-language pathologist. Speech-language pathologist plans and provides speech-language pathology services to students with articulation, voice, language, or fluency of speech disorders. Occupational therapist. Occupational therapists plan and provide evaluation of referred students to determine functional competencies and need for occupational therapy intervention based on their ability to access the curriculum and make progress on their individualized education plan. During the evaluation window, the evaluators review data from educators and parents, observe the learner and build rapport, provide direct assessment, score and interpret the assessments, write the report, and collaborate with other evaluators on the findings and recommendations. Once the evaluation is complete, you will receive a written report. The report will be reviewed with you by the evaluator or evaluators. Recommendations will be presented in the report. The school will schedule a meeting with the committee, admission, review, dismissal, or ARD, to consider eligibility for special education based on the recommendations in the report. This meeting is scheduled within 30 calendar days of the completed report. Eligibility for special education is based on an evaluation. Eligibility criteria is set by the Texas Education Agency and looks at 13 categories. In order to qualify for special education services, The child must have a disability and the need for specially designed instruction. The question we ask is, does the child have a disability that adversely affects educational performance? If the student does not meet Texas Education Agency disability criteria and does not have an educational need for services, they may not qualify for special education services. The ARD or IEP committee determines eligibility. If your child meets eligibility as a student with a disability in one or more disability categories, an individual education program will be created. As a committee, you will determine the support and services needed through special education. If eligibility is recommended, a draft proposal of services will be sent to you prior to the ARD meeting. You are welcome to request additional information, ask questions, or seek clarification. Many times, the educator will reach out to you before the meeting to address questions and concerns. You will be provided with the notice of procedural safeguards and the guide to the ARD process. Written notice of the meeting date, time, and location will be sent for your signature. Next, we'll talk about during the ARD committee meeting. The meeting will include you, the parent or parents, principal or assistant principal, educational diagnostician and or speech language pathologist, special education teacher, general education teacher, other evaluators, and the learner if appropriate. Other ARD committee members may be included depending on the needs of the learner. ARD meeting agenda. Evaluation results and eligibility determination. The committee will consider if your child meets eligibility criteria as a student with a disability and requires specially designed instruction. Present levels. The committee will review and consider your child's present levels of academic achievement and functional performance to determine critical areas of need. Goals. Measurable goals to determine what is reasonable to accomplish within 1 year to address areas impacted by the child's disability and critical areas of need. Accommodations. Support designed to give your child access to the learning. Schedule of services. The frequency, duration, and location of special education services required to support the learner's IEP. Least restrictive environment. The committee considers the maximum extent possible to be provided in the general education setting. Removal from general education occurs only if the nature or severity of the disability is such that education in regular classes with the use of supplementary aids and services cannot be achieved satisfactorily. District and state assessment. The committee considers accommodations on district and state assessment. Requirements and supplements. Certain supplements may be required based on eligibility and the need for individualized services. Examples include assistive technology, transportation, autism, personal care, transition, and graduation. After the meeting, committee members sign and indicate if they are in agreement. Documents are prepared and sent home. Educators receive a copy of the plan and receive training on implementation. The new plan is implemented within 5 school days. Parents can agree to waive the 5-day waiting period to start the plan earlier. You will also receive 9-week goal progress updates in concurrence with district report cards. In Capel ISD, we believe all students can learn and all students make progress with the right support in place. The goal of the meeting is to work collaboratively between the school and home to develop an individualized plan for the learner. We aim to consider the learner's strengths, preferences, interests, and needs, seek meaningful parent participation, set goals that are appropriately ambitious for the learner, Educate the learner in the general education setting to the maximum extent appropriate. If you have any questions about the process, please contact Sarah Carter, Special Education Parent Liaison. For information about your rights as a parent or your procedural safeguards, please contact Stephanie Flores, Executive Director of Intervention Services. Thanks.